we have cases in Ohio today, again, on our website as well, 22,131 cases in Ohio. Overall in our country, there have been 1.2 million cases of COVID-19, and our cases are up from 555 from yesterday. Our deaths in Ohio are at 1,271. That's an increase in 46 reported over the last 24 hours. In this country, we have lost 73,500 people to this disease. Next slide, Eric. Again, much of the same. Our testing is going up. We see that we're at 175,000 over that in Ohio, and our numbers otherwise pretty much the same. Next slide. And our trends, again, overall, over our 21-day trend period, again, we're still fairly stable across, so we're still plateaued for the most part. Next slide. Testing, again, this is going to be a big month for Ohio and expanding testing. We did hit, we have a good spike here, over 8,000 tests done in a day yesterday. That was a new height for us, Lieutenant Governor. But again, it's only a fraction of our goal. We're pushing very hard. We have teams working not just on testing that we can go to in centers, but also we're working on some new strategies of mobile testing, our local health departments that the governor mentioned, working on new strategies to get testing to places it's never been before, and to make sure that testing is equitably spread amongst our communities. Next slide. So I want to take a few moments to talk about how all of these things that we've been discussing go together, how we have to do two things at one time and how we go about that. So we've talked a lot about making our changes by moving that dimmer switch and watching the data, and we'll have more and more data in the weeks to come. Some new numbers will be following. But also on our keeping the spread of infection, that's our big risk as we move forward and go about our lives. So we have two big tools the governor has talked about, getting testing so we can identify cases. And this comes from Dr. Tom Frieden's group. He was the past head of the CDC for many years, someone I met in my young years in the 90s, working on projects as diverse as the Human Genome Project, which seemed so futuristic then, to being just a leading expert in the world. And he is now working globally on something called Resolving to Save Lives. He also just gave testimony and was in the news a lot yesterday. So one of the slides, these are a couple slides, we'll have them on our website for you, that I find interesting. But he's calling about boxing it in. How do we box in this virus? Our biggest risk is at any time there is a flare-up, one of the fires we need to put out, we want to know right away with testing. And then this is what we do. This is what we were doing on the way in for travelers. We test. We isolate people who are infected, ask you to stay at home those 14 days, but more importantly, the old bootstraps epidemiology is the disease detective work where we talk to you, find out who you came in contact with. If I have it, but I just saw the governor would be the first to know that he had been in contact with someone who has this disease. The person who is sick isolates. The word, so isolate is for ill, remember that, but quarantine is for people who have been in contact. We ask you to self-quarantine. Ohioans have done this all along. They've done it voluntarily, but this is where you'll work with your employer. You'll work to stay home for 14 days so that you don't spread it to others. And then we'll help you monitor for symptoms and help you get treatment if you need it. That's old school epi, it's bootstraps epidemiology. We're also using state-of-the-art new epidemiology, Governor. This is where we use diving into data for metrics. This is all the new data sets that we're looking at. This is using all our universities across the states and the best skills. We watch things like traffic patterns, and we dive into the spread of infectious disease. So those two, academic epidemiology and some of the modeling we've seen, old school, someone, a nurse or community health worker who will talk to you and talk you through it, those things coming together will help us open up and help us limit this spread. Next slide. A new number we'll be talking about, Governor, is R naught, which sounds like a very complicated number. It's really R effective is the actual name for it. But all of this is about how viruses spread. So R naught, and we'll be showing this, when we began, the spread of infectious diseases in Ohio and around the globe was about one person could spread it to 2.5 to 3 people. And in fact, when we started in Ohio, before you took the steps you did, we were spreading it to 2.3 people. We are now down to 1, which means one person spreads to one person. This is so important because this is the person with infection, and they have a chance of up to, at times, 4 people. But if we can keep that spread to one person, they might do it to the next 4 people and the next 4 people. But we're trying to keep that chain of transmission as small as possible by that contact tracing and people isolating. If you don't do this, the one person can give it to 4 people. Each person gives it to another 4 people, and that's that logarithmic spread. And before you know it, something that might even happen in a place like a nursing home goes with a worker back home, spreads throughout the community. That's where, we'll really see our cases rise in Ohio. We'll see a lot more deaths and illness. We don't want that. So our effectiveness is keeping this R naught, a new number for us to learn, very, very small. Next slide. This is a slide that is way too busy, I'm sure, for you to see on the screen, but I want you to go to our website, coronavirus.ohio.gov, and take a look at it. This slide, which looks very busy, talks about several components of things we are doing as a state, far beyond any order, far beyond anything we've done before. This map is a journey map for our year ahead and where we've been so far. But up here, and I'll do this bigger next time I think I need an old poster board, I'm missing it. But I remember I told you about there were various stages in a pandemic from when we first found it in Wuhan. And here's our curve that we are trying to avoid, the surge on the hospitals. We flattened that in Ohio. But in the journey of a year, we know that how we behave and what we do, how safe our businesses perform, we know we'll have some bumps along the road in this journey. We don't want them they can spike pretty high again, but our journey is to keep it as flat or small of bumps as possible. So we will be doing things from teaching and educating to the kinds of keeping it, this is our boxes, our testing and contact tracing, to effective case management and treating illness, to the physical distancing that we are all doing as we open businesses, and policies, ultimately at the very end, vaccines. This, if you want to look at this online, if you want a cheat sheet to every tool we have in our toolbox, it will be this adaptive response to COVID-19, and it will give you a lot of sense about where we're going. So I look forward to going over that with you more in days ahead. So to conclude, I just want to say, I've always felt all along that there was sort of a false narrative that you would say, we have to risk health on one side or businesses on the other. We know this is a journey. I personally never like to accept zero-sum games. I'm always trying to find the win in everything. And I think Ohioans can work together to find a win. There's always a third alternative when you're faced with a daunting challenge. You have to begin with accepting the reality. And the reality is this virus can be very dangerous to people, not just to people who die, but to all of us. We're hearing new news about children and inflammatory heart disease. We're learning that people are having heart disease and strokes, kidney disease, and diabetes. You're much more at risk. We'll learn more and more about that as time goes on. But it's not a zero-sum game. If we learn to accept this virus and what is dangerous about it, we will then become innovative in how to live with it. And what you heard today, Governor, were just amazing work by health professionals and businesses together to be healthy. But what we do matters. We are, in Ohio, 11.7 million of us are the business owners. We are the workers and we are the customers. We are the hospitals and the hospital owners and the hospital workers, and we are the employees and we are the patients. We are the caregivers in the nursing home and in a residential treatment program, and we are the people in those programs. It's us, it's all of us. And we can make a difference by how we behave. If we take this responsibly, we protect each other. This is our freedom and it is our responsibility. But it is our job to make these businesses succeed. And we can also vote with our feet. We can support those businesses and we can protect those workers. And if we don't see places that are doing it, we can also choose to not go to those places. But in the end, it's all of us together. I really feel, Ohio, let's do this better than any state. Let's prove them right. Let's prove these businesses. Let's help them every way we can. Let's prove a governor and a lieutenant governor who believe in us doing this right. Thank you.
Dr. Acton.